What's going on, guys? Dr. Andrew Fix back for another episode here on the Code. It feels like it's been a while since I've done one of these solo episodes. Um, Life has just been a little hectic with a newborn, so I appreciate you guys tuning in, listening to this, and we've got the baby bassinet behind me, blanket hanging over the side, and we're just gonna get it done. Okay, I am so what's the word? Like passionate or worked up over what we're going to get into on this episode, and what I want to talk to you about, and how the medical system, specifically our medical system here in the United States, is failing you and failing me and failing us. I want to tell you guys about two stories, and these are just recent examples, like literally over the past 2 weeks that have come up. And it's crazy to think how many of these stories and situations so many people are experiencing every single day, every single week, um, with our medical system. And many of you guys already know this if you're listening to this show. If you're a client of ours at Physio Room or another practice that is similar to Physio Room, you've chosen that for a reason, right? We do things outside of the typical traditional physical therapy practice, and we do that for a reason because the insurance companies don't pay well. The care is oftentimes dictated by the referral, by the insurance, and we're unable to just treat humans if we only do what the medical system and what the third party payer system allows us to do. So we've decided to step outside of the box, outside of the norm, and play a different game so that we can work with people, so that we can work with the community, so that we don't feel burnout, so that, we enjoy our lives. We get to take care of clients and work with them on quarterbacking their health and wellness. And that's kind of what we're going to talk about in these two stories I'm going to share with you. And maybe you have an experience of your own that you are thinking of as I talk about the medical system not being set up for success, not being set up for success of the providers, not being set up for success of the clients, that's for sure. And don't get me wrong, there are many things that our medical system here in the United States does well. If you have a real life-threatening concern, right, condition, injury, this is probably the place that you want to be, right? If you need to get rushed into surgery, if you have, whether it's cancer or a heart condition and you require open heart surgery or something, like this is probably the place that you want to be, because we have the ability to treat things really, really well when they're present. What we don't do well, and what we're going to talk about in this episode, is getting down to the root cause of issues and preventing things before they become problems, or really trying to dive deep on an issue and figure out what the root cause is and treat that instead of treating just the symptoms, right? So much of our system, healthcare system here, is set up to be reactive rather than proactive. Okay. So with that in mind, let me tell you about these two stories. One of them involves my sweet, sweet mother. So Mama Fix has been dealing with ringing in the ears, okay, particularly one ear. And she has just like this kind of high pitched ringing sound going on. And it's been going on for quite a while, right? Sometimes it's worse than others, but generally speaking, it's just been going on. She has this ringing in her ears, and it's very aggravating, right? It just doesn't seem to fully go away. So she talks to her primary care provider about this, right? Your normal doctor that you see. She talks to them about it. They don't really have any answers for her, which maybe we wouldn't expect them to. So that doctor does what you might expect. They refer her on to a specialist. They refer her to someone else, an ENT, ear, nose, and throat physician. In this case, she sees that person. They run through a battery of tests, and they basically end up determining, yep, you have this ringing in your ears. We don't exactly know why it's there. What we can do is just try to give you, your brain, your ears, something else to sense, something else to hear. And the suggestion that they gave my mom was never put yourself in silence, because that's when she notices it the most, right? That's when she notices the ringing in the ears the most, when there's not other things going on. So they suggested that that be the solution. And to me, that's like when you go see an orthopedic or a physical therapist and you say, it hurts when I reach up, it hurts when I do this with my shoulder. And their solution to you is, well, then don't do that thing, which we all know is not a solution. That's just avoiding the issue. That's right, just working around it and not doing anything to address it. So they said avoid silence, and instead you should always have something that you're listening to, whether that be music or white noise or some other sound on a sound machine. And unfortunately, my mom was not very happy with that answer, because, and I don't blame her, because she has a very stressful job, right? She enjoys and craves the silence whenever she can find a time that there's not a whole bunch of other distractions and things going on. That is what she craves. That's what she wants to help bring down her stress level, to help with her mental health. And unfortunately, the solution, if you want to call it that, is not one. So basically, she saw her primary care, she saw a specialist, unable to get down to the root cause of the issue or legitimately have a solution to the problem. So then fast forward, she comes out here to visit us in Colorado. My mother lives in the Midwest in Wisconsin. And she sees a friend of ours for an appointment, a neurofeedback brain scan, brain mapping type of an appointment. And based on the results of that brain map and the activity in the different sections of her head, of her brain, um, our friend Sarah ends up asking my mom on the kind of the follow-up appointment, the conversation about what we found, what they found. Hey, do you happen to have ringing in the ears, in this one ear specifically? And my mom says, yeah, I've been having that for quite a while. How did you know that? And she says, well, based on this scan that we did, um, the activity in this part of the brain, is pretty common. We see this when someone is dealing with ringing in the ears, or someone having this show up on their scan. Having ringing in the ears is commonly a symptom that they're dealing with. What was cool is that she was the one that pointed that out based on the results of the test, not my mom telling her that that was something she was dealing with, right? So my mom was shocked. And what was really cool is, they're going to plan, my mom and this provider, Sarah, they're going to plan to go through a course of treatment for neurofeedback training, brain, mental performance training, things to try and bring her from a position of, mental illness to mental health to mental wealth is what Sarah talks about in her practice. And um, these symptoms, based on clients that she's worked with before, Sarah expects this to change, right? And my mom was just so happy to have some glimmer of hope to potentially get rid of this ringing in the ears that she's been dealing with for so long, when the other providers that she's seen and gone through in the traditional medical system were unable to come up with any sort of an answer for her. So that's story one, right? Going through the traditional system, not getting a solution, deciding to go see somebody for a different reason, and them potentially having an alternative route for you to take. Now, secondly, the second story, my gosh, I was working a race this weekend, a local 5K for St. Patrick's Day. It was pushed back because of a huge snow day we had here. And I ran into one of our clients there at the race. So I'm talking with this woman, and she's someone that's been into our office for a while. She's been in with neck pain. She's been in with like back and hip pain, heel pain. So we're talking about her foot. This was a 5K. It was something that she was feeling. And what came out of that conversation was, and something she recently asked us for, is referrals, or asking if we had recommendations for a nutritionist or a dietitian or somebody, because she's looking to get someone else's input, help, opinions, and recommendations for some, chronic aches and pains she'd been dealing with, some chronic symptoms, some gut related issues that she has been dealing with. And let me sort of lay out the picture a little bit. This particular client is somebody who, she has a highly irritable, or a highly sensitized central nervous system, right? Things are just a little bit flared up from a central nervous system standpoint. She feels pain very easily. She has symptoms in different areas of her body. She recently had her parathyroid removed, so she's had some hormone changes as a result of that. And she's been dealing with these chronic gut related issues and things that she has talked with her doctor about She has went and sought out different doctors in the traditional medical system. And the literal quote that she told me when I talked to her at the race is, doctors haven't been able to help me. She said either they don't know how, or they don't want to, or they can't help me. So now she's looking into alternatives. She's looking for a different avenue to try and get things taken care of. So who did she ask? She asked her physical therapist, which I'm not the clinician in our office that has been working with her. I just happen to know her and her husband, but she asked our office, our team, if we knew any, nutritionists, dietitians, somebody that she could see for the things that she's been dealing with. And wouldn't you know it, we have several recommendations that we gave to her in the functional medicine, integrative health, nutritionist, dietitian kind of realm, because more than likely these are things that they are, when she goes and works with one of these people, she's going to go through some testing. They're going to find things that are worthwhile to change and to address and to treat, to get down to the root cause of the gut related issues that it sounds like she's dealing with. And I would be willing to bet a large sum of money that she's going to feel significantly different and better as she starts going through this course of treatment. Instead of just slapping, throwing darts and slapping treatments up on a wall, and instead of just prescribing things, medications and whatnot, to try and address the symptoms that she's dealing with, if we can do a set of testing, truly uncover some rocks, overturn some rocks to like make sure we're not missing anything, they're going to find stuff that's worthwhile treating, and it is going to help. I would be so shocked if it doesn't help her start to feel and get back to the life that she wants, get back to the life that she deserves to have. And unfortunately, our traditional medical system is just not set up to be able to do that. It's not set up to be able to have the providers have the amount of time that is necessary to listen and not be interrupted, and just literally truly listen to the clients and have the amount of time necessary to do so and really hear what they're saying, digest it, and respond with some helpful recommendations. The average doctor appointment is probably something like 7 minutes long. I haven't looked this up in a while, but I believe it's something like 7 minutes long. And the average amount of time that it takes your physician, your provider, to interrupt you when you're talking is like 18 seconds, is what I remember. Like I said, it's been a while since I looked this up. But if you're trying to share a story of symptoms that you've been dealing with, things that you've been feeling, do you think you're going to be able to really lay out all the details and give that provider a picture that is sufficient for them to really help provide a treatment plan for you if you only have 18 seconds to tell your story and your total appointment time is only 7 minutes long before they have to move on to their next person because the schedule is so back to back to back throughout the day that they just don't simply have the time to give to you? And we've all been that client, I'm sure, in the waiting room, waiting at your physician's office, whether it's primary care, whether it's the ortho, um, where your appointment's at 1 p.m. You get there maybe 12:50. You're sitting in the waiting room, and you don't get seen until far after 1 p.m. Maybe you get brought back into the treatment room or the exam room, but then you sit there and you sit there and you sit there, and they don't have a clock, right? So you're like wondering to yourself, huh, should I go on my phone? Should I grab my purse or my backpack, grab my phone and do something? Because man, it sure has been a while that I've been sitting in here. What time is it? I thought my appointment was at 1 o'clock. And that's because the system's not set up for success. It's not set up for you, the patient, the client, to have the greatest experience that you can have. It's not set up for the providers who ultimately just went to school to try and learn how to help people. There's so much documentation that's required. There's, so many restrictions that are put on the providers and on the medical facilities by the third party payers, AKA the health insurance companies, right? That are just trying to deny and deny and deny. There could be like a small coding issue. There could be, you know, something slightly off in the documentation. And I'm not talking about like, major medical record errors or anything like that. I'm literally talking about like coding and billing, small little errors like typos. And they're just trying to deny claims and deny claims so that they don't have to pay, right? We're paying all this money all of us here, paying all this money towards premiums, towards health insurance. And when you're actually trying to do something that is preventative to improve your health or wellness, the insurance is not there to help you out, right? But when it's care for preventable issues, right? All the diabetes, heart disease, obesity related complications that folks have, the insurance will pay for that stuff, right? It'll pay for treatment of conditions, but it won't pay for preventing them in the first place. It makes no sense. And these, like I said, these are just two examples that just came up here over the past couple weeks when my folks were out here and at a local community race, just talking with somebody. And we hear these types of stories every single day in our office. And I'm sure other folks listen to this, hear these stories in their life, or they've been the one to experience it for themselves. So just remember, if you have something that you're trying to get to the bottom of, and you're the client, or someone in your family is the client, you need to take it upon yourself to not take no for an answer, right? You need to be the one to seek out someone else, and then seek out someone else, and then seek out someone else if you're not getting the answers that you deserve. If you're not getting the answers that satisfy you and help you get to the bottom of the health, puzzles that you're trying to figure out. And you know, if you have more questions, our contact information is here on this podcast. Go to the show notes. Please send me an email. I'm not going to be the person, or someone on our team might not be the person to help you with the issue you're dealing with. But if you reach out to us, we'll try and help you find somebody that can, if our office is not the right place. So don't take no for an answer. Put your health in your hands and find somebody that's going to help you quarterback your health and wellness. And if the provider you're seeing isn't the one that's going to do that, move on to a different one. Again, I appreciate you guys tuning in, listening to me get up on my soapbox and talk here on the code this morning or this evening or whenever you're listening to this. If you've not already done so, a review would go a really, really long way to help get this episode and this show out in front of more and more people. We're trying to get to 200 5-star reviews on this show on each podcast platform that it's on. So please go do that if you haven't done so already. And we'll catch you guys on another episode of The Code. Thank you so much for listening.